So I'm Mario Polak from University of Ljubljana, Slovenia, and it's really my honor and pleasure to chair this session with Dr. Velepi Mtonga from Zambia. As she said, she is obstetrician and gynecologist, been pioneering vaccination in country. So we would like to set up the scene with this session and to provide you the baseline epidemiological data for the region. So we have two lectures in the session and a few minutes for questions and answers. So we will immediately start with the first lecture, which will be delivered by Dr. Ann Korir. Ann, please. So she is a senior research scientist, epidemiologist, working in Kenya Medical Research Institute and also at African Center Registry Network. And she's a pioneer in establishment of population-based cancer registries in Kenya. Please.
Good morning once again. As you've heard, my name is Ann. I work with KEMRI in Nairobi, Kenya, and also in the leadership of the Africa Cancer Registries Network, which is a network of population-based cancer registries in sub-Saharan Africa. It's a pleasure for me to be here, and thank you so much for the invite to be part of this important meeting. So I will be speaking about HPV-related cancer incidents, mortality, social and economic impact in Africa. So as we all know, cancer is a major public health concern in sub-Saharan Africa, where the disease burden has really been seen to be on the rise. And cervical cancer cases have been reported to be on the rise as per the data that we generate from the population-based cancer registries. And HPV is associated with several cancers, of course, cervical cancer being the major one. We also have vulvar, vaginal, penile, and anal cancers, cancers of the oropharynx, among many others. HPV infections is the central cause of cervical cancer. I think research has shown that HPV infection is the known cause of cervical cancer. And the impact of cancer is further accelerated by the high burden of HIV. So as you know, a lot of women, they face a double problem of HIV and also cervical cancer. So I think we all know, the experts in this room, these are experts in HPV. We all know all these types of HPVs that are predominantly carcinogenic in nature. And HPV 16 and 18 in particular have been known to cause over 70% of cervical cancer and also precancerous lesions of the cervix. So HPV, as we know, as I've said, is a known cause for cervical cancer, but it is also thought to be responsible for more than 90% of anal cancers and 70% of vaginal and vulvar cancers and over 60% of penile cancers. And recent studies show that about 70% of cancers of the oropharynx, which was traditionally linked to alcohol and smoking, may also be linked to HPV. So as we see, HPV is really a known cause of majority of the cancers that we are seeing in the sub-Saharan Africa continent. And when you look at the attributable, fraction, the fraction of HPV, the cancers that are responsible, the HPV are responsible or rather contribute to these cancers. You can see cervical cancer there is, I'm not able to. Cervical cancer here, as you can see, is over 100%. I mean, 100% of the cases of cervical cancer are attributed to HPV. And you can see the other cancers as well, the anal, vulvar, vaginal cancers, and you can see the percentages here. right? So all these cancers here have been associated with HPV. So this makes HPV, a major risk factor for the many cancers that are afflicting people in sub-Saharan Africa, and the need, therefore, to control this particular virus. Okay, right. So this is the sub-Saharan Africa region. The cancer registries, the Africa Cancer Registry Network serves this particular region. It doesn't cover the northern part of Africa. That is part of a different hub. So this is the hub for IAC, International Agency for Research on Cancer, which is a collaborator with the cancer registries globally and has done a lot of work in cancer registration. So the sub-Saharan Africa region, these are the countries within this particular region. And you can see, the number of population-based cancer registries. I believe when we compare to other regions globally, Africa is still very low. We still have, low coverage. As you can see, there are many other countries that do not even have a registry. A few of them have maybe 1 or 2 registries. In particular, some of the registries that have, shown to have some high quality data include countries like Uganda, we have Kenya, we have South Africa, and a few other countries that are coming up are developing their registries. But there's still so much need for development of population-based registries, because as we all know, for us to be able to monitor the impact, we need to have good data. We need to have data over time that we can be able to look at the trends. Even as we do all the intervention, are we able to monitor so that we are able to know whether we are making a difference? So, so far we have, sorry, this is an error. We have 25 countries, and we have about 35 registries established within the sub-Saharan Africa. A lot of these registries, like I say, are still, they still need for more work to be done to improve the quality of the data that is generated. And a lot of the estimates that we see from GloboCan, I believe most of us use GloboCan database. These are the registries that contribute data to this particular, to the GloboCan database. So when we look at cervical cancer, you can see where the impact is. Of course, it's a problem of the low and middle income countries, but it's even a bigger problem, a bigger burden for sub-Saharan Africa region. You can see this is where we have high rates and also very high mortality due to this particular cancer. Sorry. Okay. So, so we've seen that across the many countries within sub-Saharan Africa, we still have low coverage of population-based registries. But from the data that we've seen, we have over 800 new cases of cancer across sub-Saharan Africa, and accounting for cervical cancer, you can see over 110,000 of cases are responsible for cervical cancer. And breast cancer is also one of the high incidence cancers. So for the African women, we have a double burden. We have breast cancer being very high, and we also have cervical cancer. So these two cancers account for over 40% of the cases, of the female cancer cases. So, so cancer was the leading form of cancer death, and you can see in 27 countries, you can see that the cancer deaths in 27 countries, cervical cancer was the leading cause of death. And in 21 countries, breast cancer was the leading. So cervical cancer, when it comes to mortality, cervical cancer is much, much higher in sub-Saharan Africa. It is the leading cause of cancer death among women in sub-Saharan Africa. When we come closer home to my country, Kenya, we see over 5,000 new cases diagnosed from cervical cancer among our women in Kenya, which accounts for 12.4% of all the female cancers. And like I say, again, similar to what we've seen across the sub-Saharan Africa, the two cancers, cervical cancer and breast cancer, account for over 40% of the cases. So this is what I was talking about. You can see here, these are the two major cancers affecting our women. You can see the other cancers: colorectal, liver cancers, non-Hodgkin's, Kaposi-sarcoma, cancer of esophagus as well. But these two are the major cancers affecting women in sub-Saharan Africa. And we did a study to look at trends over time. And when you look at the trends over time, you can see the increase, you know, in most of these countries. You can see the increase in rates. It's only in Mauritius that we saw a decline. You can see this is Mauritius, and you can see that the rates were decreasing over time. I believe it's because of the interventions that have been put in place in Mauritius. They're able to do follow-up of their cases across the care pathway, and you know, the screening is in place, and all these interventions have been put in place. And so we are able to begin to see a decline. But a lot of the countries that participated in this study, we saw that the rates were increasing. And when we looked at the stage, you can see this is survival by stage. And when we diagnose these women early, we see that they survive longer. So this is when we diagnose them at stage 1, stage 2, and you can see stage 3, stage 4, the survival is much lower. So there is need for early detection, early diagnosis, so that we are not diagnosing these women when it is too late and, you know, losing them at an early stage in their lives. So the impact is high. Cervical cancer impact is high in sub-Saharan Africa. The mortality rate is very high, like I've said. We are diagnosing these women at late stage. And so while cervical cancer is one of the most prevalent cancers, poor access to prevention, screening, treatment contributes to, you know, 90% of the death. So we diagnose high numbers, but we also lose very high numbers. In some countries, yes, they diagnose high numbers, but they're diagnosing them early, and so they're able to treat these cancers effectively. So we need prevention strategies. HPV vaccination. This is what will be a game changer, because I think we've been talking for many years and we've been talking about screening, but now we have an opportunity to save our women if we vaccinate our girls. So cervical cancer is also one of the most common in women living with HIV. So we've also seen that we have HIV positive women, and they're having a double burden because they have cervical cancer and they have HIV as well. And this, you know, the impact is really high because you know, all these are barriers to good health. They have so many challenges: social discrimination, loss of body image, loss of sexual function and femininity. We've seen a lot of them say that their spouses, you know, divorce them because of the disease. They are thought to have brought the disease to the family. So there is so much burden among these women. And the economic impact is even higher because, you know, there is loss of income. The treatment costs are very high. Health insurance is not widely spread in most of our African countries. So they are facing all these challenges: work and employment. They are still expected to go to work, and they are having all these challenges. So the impact is really high. So as we work towards elimination of cervical cancer, and, you know, we've been given a target by 2030. I believe that is a very short time that we need to really begin to act and roll out all these programs for us to realize this particular target. To eliminate cervical cancer, all countries must each reach and maintain an incidence rate of below 4 per 100,000. And at the moment, we've seen that the incidence rates are very high. They are over 40% 40 per 100,000. So we have a lot of work to do to be able to achieve that target. And like I've said, vaccination would be the game changer. Of course, we need to also heighten the screening. We need to have screening registries so that we can be able to track these women along the care pathway. We need to have, interventions, early treatment. So each country should meet this goal of 90, 70, 90 targets by 2030 to get on the path to eliminating cervical cancer in our continent. And population-based registries, they are vital in, giving us these statistics, tracking, and being able, for us to be able to monitor ourselves, to know how are we doing, how are our intervention impacting. So we need to be able to set up good registries across the countries in sub-Saharan Africa to be able to give us good data that we are able to, use to inform policies and interventions. So to achieve, we have gaps. We have so many gaps, of course. To achieve cervical cancer elimination, there is need to improve prevention strategies, HPV vaccination, screening, and follow-up along the care continuum. There is need to strengthen cancer registries in sub-Saharan Africa and improve collection of critical variables. Staging is a problem, and so there are many things that we are doing across the sub-Saharan Africa countries to see how can we improve reporting of these important variables. So cancer registries need to perform follow-up of over 40% of their cases. We need to follow up these cases once they are diagnosed to know what happened to them. What was the survival? What did they die of? Were there other comorbidities? So there is need for us to do more follow-up of our cases. And in conclusion, the role of population-based registries has evolved from basic reporting of incident cases to monitoring population-based indicators for cancer control. And population-based registries are vital in generating data on population level survival outcomes and for monitoring the cancer care pathway. And the Africa Cancer Registries Network provides a harmonized platform to study trends in cancer incidence, survival by age and stage, at diagnosis, and also looking at, the country level human development index. So we've done a lot of our studies looking at these attributes, and we are open to collaboration. And I'm so happy to be in amidst, many players in this field. We are open as the Africa Cancer Registries Network to work together, in strengthening our registries and getting quality data that will inform the interventions that you are all doing. Thank you very much. I acknowledge Chick. Thank you for inviting me. And of course, my colleague at the Africa Cancer Registries Network. Asante sana.